Wabarakatuh. Assalamu alaikum, dear brothers and sisters. Welcome to our live streaming for the session with Dr. Najib Rahman and Dr. Mizan al-Haq, and they're going to speak to us about COVID-19 and medical insight. And I'll leave you now with Dr. Najib and Dr. Mizan. Jazakumullah khair.
Assalamu alaikum, everybody. Jazakallah khair, Lasad and Leeds Grand Mosque for this opportunity. Alhamdulillah, nice to be speaking to the congregation again. Alhamdulillah. May Allah accept all your fasting and your efforts in this Ramadan, and also the efforts of the Leeds Grand Mosque committee members. And subhanAllah, they're doing a great job keeping us connected in this time of lockdown. I know Dr. Mizan for quite a long time. I'll get you to introduce himself in a couple of minutes. He's joining us all the way from London, mashallah. Didn't have to travel up by car, can just zoom in. So alhamdulillah. And we thought it's important to share some perspectives on COVID-19. For those of you who know me, I work in A&E here at Leeds, and Dr. Mizan works as a GP, and we've both seen and understood a lot of things from our experiences, and we thought it would be a nice chance to share some of these insights and perspectives with you, our beloved community, and hopefully we'll get some questions at the end. Lasad, are they sending questions by WhatsApp or by Facebook? How are you looking at the questions?
They just on the Facebook. I prefer if they can send, if they haven't yet sent questions, please send them on the chat as we speak, as soon as possible, so we can collect all the questions and send them to you, doctors.
Fair, inshallah. So if you have questions that come up while we're doing the presentation, please send them to Brother Lasad via Facebook, and we'll try our best to answer them. This is really about sharing some knowledge and exchanging some information, inshallah. So let's see, we'll start with the presentation. Lasad, has that worked? Yep, presentation's up there?
Yes.
Okay, alhamdulillah. So actually, the first slide I wanted to mention you before is, in case you don't know, both me as well as Dr. Mizan, we both work with the medical charity Doctors Worldwide. And this is how I know Dr. Mizan. And subhanAllah, it shows the power of brotherhood and working together. And this Ramadan, we are still working in our projects as we have done for many years. And this is just a little bit of a summary of some of our activities. We've been going for 19 years, 22 countries we've been working in, more than 95 projects delivered. We were nominated for a Peace Prize, and we're still raising funds for some life-saving care. So, do remember us in your dua and with your pockets as well, inshallah. So moving on, how this presentation will go through, we're going to try and cover 4 sections, a little bit about the background of COVID-19, some issues around prevention measures, some specific medical advice, and hopefully this will be more practical medical advice. And then actually it will be an interactive part with yourselves with the Q&A. So with that, I will hand over to my brother, Dr. Mizan. Mizan, you just let me know when you want me to flick through a slide, inshallah. We'll start off with this next one.
Sure. Thank you very much, Dr. Najib. And assalamu alaikum wa rahmatullahi wa barakatuh, everyone. It's a pleasure to be a part of the Leeds community, albeit sitting in my room here in London. And inshallah, we can share some useful, beneficial insights and help answer your questions, especially with what's going on, given the gravity of what's going on and the fact that there is no quick exit to the current situation. So inshallah, hopefully there'll be barakah and blessing, and especially blessed and privileged to be joining everyone at this very blessed time in Ramadan. And we request your du'as also. So I will start off the discussion, and I'll be going at a slightly fast pace. And I believe over the last few weeks, we've all been exposed to a lot of information about coronavirus, COVID-19, and there is a lot of discussion. There are a lot of news reporting and other kind of discourse around this area. The purpose of today is to organize it for you and also try to make it relevant to you. So there are certain parts of the discussion that perhaps may not be as relevant. So what we want to do is we really want it to be helpful for the community. And unfortunately, our community, the Muslim community, as well as the Black and ethnic minority community, are a lot more adversely affected from this illness compared to the general population too. So we really have to try our best to equip ourselves with the knowledge of how we can try our best, with Allah's rahmah and His support and blessing, how we can keep ourselves safe, how we can keep our families safe, and then our communities and our neighbors safe also. So very quickly, so this is a small diagram of the coronavirus. It's a very simple structure. Viruses are some of the smallest things that are known to us, and essentially the virus has a bit of genetic material and a bit of lipids, fat, and a bit of proteins, and that's it. And in terms of size, it's the smallest thing, as I mentioned, that's known, or living thing that's known to humans. And in and of itself, it can't replicate. So what it does, this is an example of the human cell. These viruses go inside human cells, and then they use the cell's machinery and they replicate. They make millions and billions, and then that process goes on and continues. And that's how they kind of cause us to fall ill. Now, on the right, you will see a very basic diagram of the human respiratory system, so the human breathing system. And the reason to put that there is, so this virus is from a large group of viruses that can cause many different symptoms, but primarily in our breathing system. So sometimes in the past, you may have got a virus that has caused a sore throat, or that may have caused a tonsillitis. If in more severe cases, what can happen is these infections can actually go down, lower down into the breathing tracts and cause things like pneumonia. So that's when there are fluid within the lungs, and the lungs take in oxygen and get rid of the carbon dioxide. So if you can imagine, if the lungs are full of fluid, there's no area for this air to come in, and that's when pneumonia and when coronavirus COVID-19 can cause, when it does cause pneumonia, it becomes a lot more serious. So that's just one of the reasons why. So Najib, if we could move on to the next slide, please. Now, how does it spread? The primary way it spreads is from one person to another person. So if one person has the illness, they might cough, they might sneeze, or they might not cough or sneeze, but they might still have it in their breath or in other bodily fluids too. And that's the primary way it is spread. The secondary way it can spread is by surfaces. So if somebody coughed or sneezed and they have some of those secretions in their hands, and then they touch something, and then somebody who didn't have the illness actually touched that same object and then touched their hand, face, or mouth, that would be the other way that the virus would enter, by the nose or the mouth also. Now, what's important to mention is there are a group of people who might not have symptoms, so they might not actually have the cough, the fever, the sore throat, but they might still be infective. That's called the incubation period for any virus. And what that means is you don't have the symptoms of the illness, but you can still spread it. And for this particular virus, that period can be up to 14 days is the prediction, which makes social distancing measures even more important. So just because someone's well doesn't mean that they don't have this virus. So next slide, please. Now, what's reassuring, we've all had coughs and colds in our lives many a times. And myself as a GP, I see a lot of people with coughs and colds. So there was a period in my work, I was catching a lot of coughs and colds. And the human immune system is amazing. It's absolutely remarkable. It's literally a whole series of, you can call it soldiers, that fight off these infections in many different ways. And the reassuring thing, despite everything that's happening, is approximately 80% of people who catch this virus, their body will sort it out. That's not to say they won't get symptoms. That's not to say they won't feel unwell. They won't their level of normal activity will go down due to the illness, but their body can and does sort it out. So that's actually quite reassuring. And from a healthcare practitioner's point of view too, after an assessment, often we kind of advise just general good hygiene measures and good self-treatment, which we'll discuss later on, without any additional, for example, hospital treatment or admission or fluids via the veins and things like that. And this is one of the reasons why, because the vast majority of people will fight this illness by themselves and recover by themselves. Not 20%, if 80% get better by themselves, 20% won't. They will need more active intervention and support. Now 20% is still quite a large number, which makes this illness the challenge that it is. So next slide, please. Okay, so there is an age-old maxim in medical practice that prevention is better than cure, and definitely in this illness, definitely with most infective illnesses, prevention is better than cure, and we don't have a cure also. So how do we prevent this? There are several things. So we'll start with hand hygiene. As I mentioned, one way to pick up this virus, especially if we are outside, outdoors, doing shopping in workplaces, is by touching things and then touching our eyes, our face, our nose, which is the way that this virus enters into the body. So lots of very good hand washing, ideally with an antibacterial bacterial hand sanitizer or alcohol gel, which kills bacteria and viruses. Now, in medical schools, what we do, we actually test and examine our students in washing their hands. So just to make sure they're very thorough, because rather than a quick hand wash, the advice is to at least spend 20 seconds minimum to wash your hands and ensure that all the different parts of your hands, the front, the back, in between the fingers, the thumbs, the nails, inside the nails, everything is being covered. Keeping a distance of at least 2 meters with, it says here, anyone who coughs and sneezes, but generally with anyone really, especially if you leave your house, to try to keep that distance. And the larger that distance, the less the chance that if somebody coughs or sneezes, that there will be that transmission. Try your best not to touch your eyes, nose, and mouth, and we do it without thinking. So especially if we are outdoors, we need to be extra conscious and do lots of hand washing and really avoid touching a face whilst especially outside, and indoors also to be cautious. Also, cover your mouth and your nose, with your elbow if you sneeze, or with a tissue. So the idea is if you cough and sneeze into your hand, then you touch everything, then we are spreading those small particles far and wide. So try to catch it in a tissue and then throw away the tissue and wash your hands. And obviously, if you're ill, seek medical attention, and we'll come on to that in more detail. And some of the the social distancing measures as per the local advice also, which we'll discuss. So next slide, please. Okay, so the reason for some of the social distancing, so we don't have a cure, we don't have a vaccine, and this virus is spreading quite a lot. So what do we have? What we have is some of the social measures we have seen in this country and perhaps in majority of the countries in the world to face this current pandemic that has arisen. Now, if you look at the diagram on the left of the screen, the one that talks about social contact, if we were not doing any social distancing, then on average, about 2 to 3 people, one person who gets the illness will share it with another 2 or 3 people. And then and that would be in a few days. And then after 30 days, that will be 406. And then you can imagine the graph, it just goes up and up and up. Now with social distancing, that number, you may have heard of the R0 number, becomes a lot lower. And the aim is to get that less than 1. So if one person, for example, infects 1.25 people, then after 30 days, it becomes 15 people on average. So that's why those social measures are very, very important when looking at the health of communities and obviously as within our own health as individuals. The other advice that we are giving is if anybody has cough, cold, sore throat, fever type symptoms, then it's very important to stay home and stay isolated for a minimum of 7 days. And for the household members, so those people who live with that person who's unwell, to stay isolated for at least 14 days. Now, as I mentioned, some people can be without symptoms for a period of 14 days and actually have the virus. Hence, the advice is for those people to at least wait for 14 days. And if after 14 days they don't have any symptoms, then the current advice is that they can kind of go and they can leave the house. So those measures will help reduce the spread of the virus in the community and help us tackle the pandemic. So if we move on to the next slide, please. Okay, so this is a bit of a busy slide. And essentially the aim of this slide is to communicate one fundamental message. We are all at risk, but some segments of our community are at more risk than others. And those members of our community, be they our viewers who are participating today, or family members or friends, they need to take extra precaution. So all the data shows that the higher a person's age, the higher the level of mortality. So people who are extremely vulnerable are our elderly population. So over 60 years old, the mortality rate is higher. Over 70, it gets even more higher. Over 80, it gets even more higher. So for that group of patients and our population, it's vital to really limit how much you go outside, and for other family members and community members to perhaps help support in whatever way we can to facilitate that reduced contact that segment of the population will have. And also, if you're in that age group, or if your family members are in that age group and then they fall ill, they get symptoms, I would encourage that we have a much lower threshold to actually get some medical advice. Secondly, about 80 to 90% of people who've very sadly passed away as a result of this illness did have pre-existing conditions. Especially, this is data from the UK. And in China, what they found in the earlier stages of the illness is people with heart disease, pre-existing heart disease, or people with diabetes or respiratory breathing difficulties or high blood pressure. Those groups of people were at much higher risk of having severe disease and passing away as a result of the illness compared to the rest of the population. So again, the advice is, if you or any of your loved ones fall into this category, you have to be extra cautious in terms of the precaution measures that you take, number one. And number two, you have to, with your doctor and your healthcare professional, take a proactive approach to make sure, for example, your diabetes or your lung condition or your high blood pressure is as well controlled as possible. There is a very small group of people who are in the very high risk category, and hopefully that's not a lot of people, but these are people who are either due to an illness or due to medications for an illness, the immune system is severely compromised, is severely weakened. So people who, for example, have had organ transplants, or people who have chemotherapy or other types of cancer treatments, or certain types of cancers of the blood, or people who've had bone marrow transplants, they are at very high risk. And additionally, people who have other illnesses of the immune system or are pregnant and also have a very serious heart condition. For this group of very high risk patients, the advice is to stay at home for initially the advice was 12 weeks stay at home, but pretty sure that will be extended. So the advice fundamentally is to stay at home, not leave your house. Try to get other members of the family or other members or other relatives or friends to do your shopping for you and collect your medications for you. Also, if you do live with other people within your own household, to keep a 2-meter distance from those other people. And if you're sharing bathrooms, for there to be very good hygiene measures, using disinfectants to wash the bathroom. So really to take all necessary precautions as much as possible, because the problem is, if your immune system is severely suppressed and if the virus enters, then the virus doesn't have any checks and balances that can reign free, and the effect can be very, very dire. So next slide, please. Okay, so we've talked a bit about what the virus is, how it acts, how we need to protect ourselves. Now, what we are going to focus on in this part of the discussion is really some medical advice. So if my patient were to call me about this illness and they might have some symptoms, what sort of advice would I be giving them? Now, like many viruses, this COVID-19 coronavirus can cause a whole range of symptoms, and different people will experience different symptoms. The commonest symptoms are feelings of tiredness, a very high fever, a high temperature, a dry cough, but it can also be a cough with mucus, and difficulty in breathing. Now, these are the commonest ones. There are other symptoms too, such as a sore throat, muscle aches and pains, lethargy, headaches, chills, skin manifestations. So it can be a whole range of different symptoms that this virus can cause. So next slide, please. Within the medical community, we have a term called red flags, and when we are teaching our students, we also talk about red flags. And red flags, what it means is these are a group of symptoms that if somebody has them, your doctor gets very worried very fast that is there a risk of serious illness here, and can this deteriorate very, very fast? So if I'm doing a clinic, for example, and one of these symptoms come up, my full, total, and undivided attention will go towards that patient, because these symptoms kind of set off alarm bells in my brain that there might be something quite serious here. And the reason to discuss this with yourselves is, if anybody does get these symptoms, you should be worried and you should seek help ASAP. Okay, so I've categorized them in terms of the systems within the heart. So in terms of someone's breathing, if they are actually finding it quite difficult to breathe, if they feel their breathing is very, very tight, or they can hear whistling sounds or wheezes when they're breathing, or they can't complete full sentences. So I'm speaking to you and I'm completing a sentence or two in one go, but they have to stop and take a deep breath in, or take a breath in between a few words, or if the breathing is very fast. Those are symptoms that the lungs are struggling, their breathing is struggling, their body is struggling, and they need help. Also, if with this illness, if somebody is coughing up blood, that's a sign that the symptoms might be a bit more severe and definitely needs a medical review. Now, from a heart point of view, if someone's heart is persistently, continuously beating and racing, if they are feeling very dizzy or they actually faint, if they get severe chest pain, or if they start looking pale and blue, either around their lips or around the fingers, and also if they, for example, go from one room to another room and become quite short of breath, or go up and down the stairs and get short of breath, that's a sign that the body is struggling, the heart is struggling to do its normal job, and that does require medical review. And other symptoms that suggest quite severe illness is confusion. So somebody who's not normally confused, if they start getting confused, if somebody isn't passing urine as regularly as normal, that's a sign that they might be getting dehydrated. If they're unconscious or they're difficult to rouse, if they've got a persistent high fever and that's not getting better beyond 7 days, 8 days, 9 days, and also if they've got a very severe headache. Now, these are just the common ones, just to give you a bit of an indication. Now, if somebody doesn't have these symptoms, but they have other symptoms that they deem to be very severe, do still please reach out for medical advice. Next slide, please. One other concern we have is from mothers, especially mothers of young children and babies, because babies can't tell us when they are unwell. And how can you tell how your baby is? Is it a small sniffle and I should just monitor, or is it something that's quite serious and I need to contact my doctor and my medical team? So there are red flag symptoms for babies and young children also. And these are things that if you do spot them in a child or a baby, do get some formal medical advice. So if baby's feeding has gone down and they're not drinking their milk as regularly as normal, that's something that needs to be discussed further. If the baby isn't wetting their nappies as regularly, in terms of timing, if they were wetting their nappies, for example, every 3 hours, and now they're doing it every 6 hours, or if the nappy isn't as heavy as normal, again, that's something that might suggest dehydration. If they're very, very lethargic and they're not rousable, even their cry is a bit of a whimper rather than a strong cry, that could be quite worrisome. If the inside of the mouth, so babies often drool, but if it's looking extremely dry, is that dehydration that needs to be considered. a non-blanching rash. So these are the types of red rashes that come on the body. And if you press a glass on the rash, it doesn't fade away and disappear. So one of those rashes can suggest septicemia, infection within the blood itself. Very fast breathing, or the chest looking like it's being sucked in, that's worrying. If the baby doesn't have the lovely, nice pinky color and baby looks bluish or grayish, and if baby is very, very floppy. So again, these are just indications of severe illness in a baby. That's not to say there aren't other symptoms too. And if you are worried, then obviously do seek help. Now, if you could go to the next slide, please. Okay, so now if somebody does become unwell, what's the best way to care for yourself? What do you do? When my patients call me, what would my advice be to my patients? So first things first, general measures. We've spoken about prevention measures. Also a healthy diet and exercise. I think what's really important with our health, especially for those of us who are blessed with good health, is not to start thinking about our health when we are affected with an ailment. We, just like we need to take care of our cars, we kind of need our MOT, we need the fuel and the oils changed, and we need to take care of our houses, and if we don't, dust will build up and it needs maintenance and what have you. Our health is such a great blessing, alhamdulillah, and we need to take care of it too. So what we're eating, we need to be conscious of, and exercise is really important. The example I sometimes give is this. So if we imagine our immune system as an army that defends us against multitudes of different viruses and bacteria. So imagine we had a small army that is going to defend the population of Leeds. Now, if on a regular basis, this army, they eat chips and burgers and pizzas and all the things that we know we should enjoy only once in a while, but not regularly. And then 1 year later or 2 years later, they're actually called for action and we need them to defend us. The chances are that army isn't going to be very effective just because of the type of lifestyle and the training it's had to date. So similarly with our bodies, if we're not taking care of our body, if we're not being a bit cognizant about what we are taking in, then when we need to fight off those infections, perhaps our defenses won't be as good as they would otherwise be. And I'm really pushing that point in because I think inshallah, this pandemic in time will go away, but there are many things that will come and go, and there's no substitute for taking care of our health. And inshallah, as long as we have it, it will enable us to be better servants of Allah, to do the duties that we have from our day-to-day life, our work, our families, and beyond. For those of us who smoke, stopping smoking will immediately improve many different defenses within our respiratory system, our lungs, and also it will reduce the risk of several illnesses too. So it is difficult to do. There is help and support out there, but that's something that for those of us who do smoke, we should really try to think about, especially in the month of Ramadan. I think we should take that opportunity. Emotional well-being, so the mind and the body is obviously linked. So with our spiritual well-being and our emotional well-being, that will also have a direct correlation to our immunity and our physical well-being too. So harnessing good relationships, our relationship with our creator, and also our relationships with those around us. And it's a really important area which is beyond the discussion today, but perhaps at a future time we might discuss, just because of the impact of the lockdown, of people being stuck indoors, of dealing with bereavement, and also for those who've been impacted quite severely in a financial way. There is a lot of mental health issues that have been exacerbated, and it's important that we help each other out as we can and take a proactive approach to ensure our emotional well-being. Multivitamins may help. So vitamins play a role in our immune system. Generally, with a good varied diet, we'll be taking in a lot of the vitamins that we need, most of the vitamins that we need. In the UK, especially vitamin D, the one that we get from the sunlight has a role. We tend to find that that's a bit lower in populations just because we don't get enough sunlight, and also if we're stuck at home now, so that can mean our vitamin D is low too. So multivitamins may play a role in optimizing our immune system also. Do you have a chat with your pharmacist to discuss which one is most appropriate, especially given age and given what the contents of the vitamin tablets might be. And for those who have chronic diseases such as asthma or diabetes or high blood pressure, then good management of those illnesses is important too. So those are general things to care for yourself. If somebody does get an illness, what should they do? They should ensure that they keep well hydrated, lots of fluids. If you're ill, then if it's very, very mild, maybe, and you're quite healthy, then fasting, perhaps you might want to continue fasting. But if you're actually ill, you've got fever, and you're feeling quite unwell, then, Alhamdulillah, Allah has given us the blessing that, we can make up those fasts at another time. And so it's important to keep well hydrated. Paracetamol for muscle aches and pains and for fever, and also taking good rest, let your body recover. Home remedies such as honey, lemon, and other home remedies may also help. And there are different things you can try for your symptoms, depending on what those symptoms are. There's a small list here, so cough syrups, antihistamines, steam inhalations, just to help the symptoms, calm it down a little bit, and good hygiene measures. So if there are any questions, I mean, I have rushed through some of these thoughts and ideas, and do obviously write them down. Now, the truth is, with inshallah, this will mean most of us stay well. As I mentioned, 80% of people won't need further medical support, but 20% of us will. And what happens when we go into hospital? What happens when our health deteriorates further? So I will shortly hand over to Dr. Najib to talk about that. Just before that, just because of the changing landscape that we have currently, what tends to happen is a lot of the communication that we have these days is via telephone call rather than face-to-face. So there's a few activities that you can do. So when you contact your doctor, if you not only tell them that you feel unwell and you've got these symptoms, but if you can count your pulse rate, if you can count your respiratory rate, how many times you're breathing in a minute, that will give invaluable information to your medical team about what your body is doing. So I've put some YouTube links there. If you're not sure how to do that, do try to learn how to do that. If you do have a pulse or a blood pressure machine, you can take those readings too and share those when you do contact healthcare services. So I'll hand over to Najib now.
All right, Bismillah. So, we started off this journey talking a little bit about the background to the disease. We've looked at some basic ideas of symptoms for us in general, and also things to look out for, things that we as doctors get concerned about. And those red flags that Dr. Mizan mentioned, those are actually almost for any illness. They're not specific for coronavirus and COVID. We think of it in those conditions, but also any illness, we worry about those red flag symptoms. Now, when you get those red flag symptoms, this is where I guess I come in from an A&E perspective. And this is why I think both Mizan and I wanted to speak to you, because we have this transition between primary care with the GPs and then coming into A&E. So one thing to reassure people, and I think things are changing a little bit, but a few weeks ago, we found that many people were actually not coming to A&E because they were quite worried about what was happening in the hospital. We saw all the news about COVID infections, and we didn't want to get infected ourselves. So what's important to recognize is that, emergency conditions and injuries are still being managed as they normally get managed. So chest pain due to heart attacks, severe abdominal pain due to maybe gallstones or other illnesses, broken bones, we're still seeing all of those cases in A&E. That the routine business doesn't stop. The main thing that's different is the hospital now is divided into COVID areas and suspected COVID areas and non-COVID areas. So when you do come into hospital, it will be a different experience than what it was before. So again, just to reinforce, there are still conditions that you should be able to manage at home with self-care and using advice from the internet and other sources. You can still access NHS 111 if you're not sure what to do. You can access your pharmacy for further advice for basic illnesses. Your GPs are still open. Yes, the consultation might be different with telephone-based consultation, but they are still providing that service. We still have some of the NHS walk-in services offering services, and the hospitals are still open. So coming back to our department and what things will look like, what's different. essentially, when you come into the hospital now, you'll be greeted with a nurse and you'll be asked to stand 2 meters away from the nurse's desk. So there'll be a desk in the department, you'll be 2 meters away from that. And the nurse will ask you some basic questions to try and decide whether you have potential symptoms, including COVID, or whether you don't. Now, it doesn't mean that every patient that then goes to that red zone will have COVID, but it means you might have a fever, you might have a cough, you might have some breathlessness. And so automatically, if you have any of those symptoms, you will trigger to go into the hot zone. So that's one thing to be aware of. If you don't have those symptoms, you'll be transferred to the cold area or the green zone. And things might change. You know, again, if you find that while you're in that area, you then develop a fever, you'll be moved. So the department is divided into these areas. And this is mainly to try and stop cross-infection between patients and between the public and between the staff. Visitors will be asked to leave. So if you're used to coming in with all your family, that cannot happen. And I think this is a big issue for the Muslim community in particular, where we're used to utilizing the barakah of visiting the sick, and we want to accompany and we want to help our family members. Maybe if they don't speak English very well, we're expecting to be with them. That can't happen anymore. So patients will be left and the visitors will be asked to leave. Only the patient can remain. And then you'll be moved to the different areas. Now, it might be that guidance will change with time, but this is not a policy that, you know, is being led by individuals. This is a policy that's being guided by government, but also then instituted by different hospitals to try and protect staff, to protect patients and protect the public. We know, for example, in many other outbreaks in other diseases around the world, whether it be SARS or Ebola or cholera, lots of other outbreaks, we know that sometimes places of worship and hospitals are high zones for cross-infection. So we have to be very sensitive to our responsibilities of not contributing to further infection. Now, if you are coming into those red zone and you have a suspected COVID case, you will be managed according to severity. So we'll do some basic assessment to try and decide how unwell are you. If you are breathless, if your oxygen levels are low, you will more than likely have further tests, including an X-ray, maybe be given some oxygen, and need some further blood tests. But actually, if following the first assessment, maybe your oxygen levels are not low, maybe you're speaking in full sentences, you don't have high fever, we're not worried about another condition, you will be considered a green case, which means you'll probably be sent home to follow for self-care. And this might seem very strange. You might say, look, I came to hospital, I was worried about my illness, and I wanted to have some treatment. I wanted a drip, I wanted some paracetamol, I wanted some antibiotics. The reality is, as we already discussed, most patients will recover without any treatment. And therefore, if on the first screen you look to be quite stable, there will be no other tests that are offered, and there'll be no other treatment required. So you'll be asked to go home and to provide self-care. Now, again, if things get worse, you should highlight your concerns. Like Dr. Mizan mentioned, if you start to feel more breathless, more unwell, you need to get further advice. And there's always the chance that someone that gets sent home might get worse and need further advice later on. So we're not going to be keeping patients automatically if they're in the green kind of category of severity, but we understand that that disease might progress and you might need to come back again later on. If you are in the amber category, and so maybe you have some oxygen levels that are fluctuating a little bit, or maybe you seem more tired and unwell, then you will be having some basic blood tests. Now, if those tests come back all pretty normal and you seem to settle down with basic fluids and drips and things, then you'll probably be sent home again. But more than likely, your case will be discussed with one of the more senior members of staff in the A&E team. If you're admitted, then you'll have the COVID test sent. Now, again, the COVID testing policy might change. At the moment, we're testing anyone who is being admitted to hospital. But we are not yet testing people who are being discharged back into the community. But again, this might change as per government guidance. So again, you might think, how come I'm being sent home and I don't even have a test? Unfortunately, it's not up to us. This is partly related to the guidance and availability of testing. Now, the last category, if you're in the red category, then you are clearly going to be admitted to hospital. This means that, you know, maybe your pulse is high, your oxygen requirements are there, you need to have some extra oxygen to help your breathing. Maybe your blood test showed something of some concern. So, you know, in this case, you will be admitted into hospital. Hopefully, inshallah, you will not need anything more than some oxygen and some fluids. But for some of those cases, you might need even more care in terms of intensive care support and extra machines to help with your breathing. Now, this is where, you know, sometimes people get very concerned about, what if I'm really unwell? Will I be considered for these high-level cares, such as intensive care treatment or not? And I think this is always a controversial topic. All I can really do is to reassure you that we are not making decisions on intensive care access based on severity of illness alone. We are carrying our normal assessments for whether a patient will benefit from intensive care or not, like we have always done. So if someone has got lots of other complicated illness, the same way that even before COVID, if they came in with kidney failure or liver failure or had a very bad infection that meant they looked like they were passing away, those same decisions as to how beneficial will intensive care be, we'll be making those same decisions anyway. And that unfortunately does mean that certain patients will not benefit from intensive care, and they will be kept comfortable to preserve dignity as best as we can within the hospital setting. And it goes back a little bit to that initial slide that Dr. Mizan shared about who are the patients that are affected by this the worst. And it does tend to be the patients who are more elderly and who have other diseases. We have tragically seen, unfortunately, with COVID, it is killing people of all ages, and even those people who have never had diseases. But we have to be aware that still the majority of people who are passing away with this disease are the elderly and those with other diseases as well. So just to reiterate, not all A&E patients will be having COVID-19. We will still be seeing other patients coming in. Not all suspected COVID-19 patients will need to have extra tests, and not all of them will need to be in hospital. Not all the patients that get admitted to hospital will need to be on ventilators, and not all patients will actually benefit from ventilators. Ventilators itself can cause further problems, such as ventilator-associated pneumonia and other diseases. Unfortunately, there are still no specific treatments that have been proven to work for COVID-19. However, there's lots of trials going on. So you might be asked to join a trial for treatment, similar to what happens with cancer therapy, where many trials are happening, and you might be asked to take therapies as part of a study. But it's important to recognize that we don't follow these rumors of various treatments that are available. They don't work. There's nothing proven as yet that works. So we have to be aware of that. And again, just like any other severe illness, severe COVID illness and its complications on the liver, on the kidneys, on the heart, will make this condition very difficult to manage, but the same as any other severe illness. Okay, so we've talked a little bit about how you will be received into the department, the different zones you might go to, how you'll be assessed, but this is actually who you might see if you're in the warm zone, right? So you might be seen by someone wearing all these gowns and PPE, and it might seem very scary coming into hospital on your own to speak and see someone like this. Communication can be difficult when they're wearing a face mask, when they're wearing the face shield. So you have to be aware about your ability to communicate. So make sure you have your phone with you, make sure it's fully charged. This way, maybe you can contact a family member or relative to help you with this communication challenge. Also be aware that there will be sensitive discussions happening place. We are now asked to routinely discuss issues of end-of-life care when you come into the hospital. So even when you are not unwell, you will be having those sensitive discussions about what care plan will be happening. And if you get more unwell, what are the decisions that might be made around your care? So please be prepared to have those discussions. Maybe have those discussions earlier on with your family. Now, this should not mean you don't come to hospital. If you're unwell, you should still come to hospital, because majority of patients are being managed and are being discharged back home to the community safely, alhamdulillah, and recovering, alhamdulillah. But it does mean that we need to be prepared for those sensitive discussions that we're maybe not used to having. We need to be prepared to think about these difficult ideas about our own life and our own death, which we don't like to think about. But surely if you're prepared, you'll be easier to have those discussions when you meet my colleague dressed like this, as opposed to having that for the first time. So that's a little bit of a summary on the critical care and emergency care aspects. In order to seek help, again, for non-emergencies, you can call NHS 111. You can contact your GP surgery that will have telephone triage. There will be what's called hot hubs for further treatment. And again, if you're worried and you're unwell, you can still contact the ambulance, call 999. There is also out-of-hours clinics, and obviously in A&E, we are still open. And just consider those things that we discussed. There are some resources, plenty of resources available through the NHS websites, as well as the World Health Organization websites. That's about it, really. So, inshallah, I'll hand back over to Lasad. Lasad, if you have any key points that you'd like us to discuss or to raise. Just to recap, we talked about COVID, we talked about prevention measures, we talked about medical advice, and now, inshallah, we can have a chat about any questions that have come up.
I've got some questions, Dr. Najib. I'm going to send them on the chat, and I did put them on I've already put them on a PowerPoint. Okay, I'm going to send them to you now to the chat.
Okay, so
Check them out.
I'll stop sharing the slide. If you need, you can put your own slide up.
Have a look at the questions. Some of them maybe it's just information, but I kept copy paste and
okay.
You go to the chat. As we're waiting, I'll put the PowerPoint. Yeah.
Okay.
I'll share the PowerPoint.
So let's try and go through some of these questions. And again, we might not have all the answers, but I think this is sometimes more of a discussion as well. So, yeah. And we can involve yourself and obviously Dr. Mizan as well in that. So the first one on the chat, where is it gone?
I've got to the presentation now here.
Yes. So the first one was, there is a lot of theory circulating. It's not as bad as we're told it is. What's your experience? So I guess the question is, what does bad mean? We have had, subhanAllah, almost 40,000 people die in this country. How much more bad does it need to get? So I think maybe it's because we are, for a lot of us, we're secure in our homes, alhamdulillah, and we're feeling secure, we're with our families, we can go out to the shops, the weather is nice, maybe we feel it's not too bad. We also know that, alhamdulillah, for the hospitals, at least in Leeds and in Yorkshire, the hospitals have not been overwhelmed the same way as was maybe shown in Italy and in Spain. So maybe it doesn't feel that it's that bad. However, we do know that in London, many of the hospitals were at breaking point in terms of intensive care and the measures they had to make. Alhamdulillah, no one ever had to make decisions of not treating people because of lack of resource, but we were very close to that. The thing that stopped it was the lockdown measure. So everyone will be looking very carefully now as to what happens once the lockdown eases and what do people start to do. This goes back to the R number, which Mizan mentioned. This is called the reproductive rate for the virus. If that starts to go up again, then we could have difficulties again. So it depends what people say about theories circulating. SubhanAllah, it is still a very nasty illness. We have still had a lot of tragic loss of life. We should be grateful for those of us who are still okay. I think it's difficult. I think my personal experience is that from the Leeds Hospital perspective, we are functioning fine and we need to reestablish our normal services, but life can't go back to what it was like before. I think trying to think that we'll go back to living the way we were before this pandemic is wrong. We will cause more harm to ourselves and each other. Mizan, I don't know, Mizan, if you got any other points of view on that.
Yeah, so I'll just add 1 or 2 points. And actually, Dr. Najib, is from a conversation we had. So obviously, in the interest of time, we try to keep today's discussion quite focused. And given the fact that in the country, we've had the second highest death rate in the world, we didn't kind of discuss how bad it is, because it seems quite bad. Definitely, as a doctor who's working in London, I've had patients, unfortunately, who've passed away from this. I've had patients who I've consulted with sore throat and a cough. 1 week later, it was getting worse. 1 week later, they were in hospital, and 1 week later, they had passed away. And we've seen kind of quite severe illnesses amongst healthcare staff, also amongst other vulnerable communities, and in some very well people too. So we've definitely seen it from the front line that it can manifest in a very bad way. Without the social measures that were done, I think it would have been a lot worse. And the other thing to note is we are not coming close to the end or even the start of the end, if that makes sense. So it's going to be quite a long journey also. And just to compare it with some of the other big killers, I mean, initially when this virus came and when the social measures were being discussed, some were thinking about, look, this is just the flu. It might be a bit worse. Why do we have to take the response that we have done as a society, and perhaps even as a global community? Now, it's not quite like the flu. In terms of the flu is quite well researched. It does kill a lot of people, but there's a vaccine that exists with the flu. There are treatments that are given if somebody is hospitalized with the flu. And also the mortality rate from the flu is 0.1%, whereas the mortality rate from COVID-19 is anywhere between 1 to 5%, depending on different circumstances. So there are quite a lot of differences. What one can easily do is one causes fever, the other one causes fever, and there are some similarities and differences. Hence, some may fall into a kind of a thought of just amalgamating that it might be just like the flu, but it is quite different. And our anxiety is that second wave and what's happening with this R number. Is it going to stay down, or as the social distancing measures slowly, step by step, get reduced, will we see that R number go up, in which case it continues to be a major issue?
Actually, that moves us quite nicely to, I'll go to the third question, Lasad, which is talking about the R number. And then we can go back to question 2. So,
no.
Yeah, that's the one. The one you just passed, the R number. Now, this is quite a complicated thing, but you'll probably see it, shown around on the news. It goes back to the slide that Dr. Mizan showed of the infection rates between people. Effectively, the R number talks about how many people can be infected from one person. So if you have 1 to 1, that means if I go now into a crowded place, I will only infect one person. That's kind of an R number of 1. Whereas an R number and that one person will then infect another one person. If you have an R number that's more than 1, it means that one person is affecting more than one person. And that means it's spreading in a more kind of pyramid kind of structure. So it goes back to say, well, how can you keep the R number down? Well, the whole point is to limit the social interaction. The more social interaction you limit, the less chance that one person can infect another one. Normally, so this is prior to the lockdown, they were saying that with COVID, one person was on average infecting about 3 people. So in normal social activity, one person was infecting about 3 people. So in a crowded place, that could be more, but as part of normal social interaction. In terms of the current R numbers, I think the BBC, I'm just reading up today from a message I got today. So the R number in northeastern Yorks is at 0.8. In England in general, it is 0.75. In London, it is now down at 0.4. So actually, in Yorkshire, it's higher in terms of the reproductive rate, in terms of patients infecting other people. So it's a difficult one. I think the alerts will be issued variably and probably will only really start happening when we go back above a number 1. And again, these R numbers are predicted, so they're not exactly at the right time. They take time for people to analyze these infection rates and then produce it. So it could easily be almost 1 week or 2 weeks behind the curve when we look at these rates of infection. So a complicated question, but hope that answers a little bit. Going back to the second question, which is how is it not affecting some countries as badly as the UK? So it depends again of how these countries are managing the initial introduction of infection, and also how good are they testing and monitoring their health system. So countries that have had this virus for a while and done very well, we think about places like Singapore or Taiwan, and this is all about early case finding. So right at the beginning, controlling the numbers of cases coming in. When you find a case, contacting them, contact tracing. So this is finding out each of the people that infected person has been in touch with and isolating them. So this is preventing spread in the community. And actually, we have done that historically in the UK with other diseases. So if I had a case of a patient coming with suspected meningitis, normally the public health team would contact that family, give all those family members antibiotics, find out who that child has been in touch with in the school, contact all of them, and look at the risk of them having contacted meningitis. Likewise for measles or other infectious diseases. So actually the theory is the same. With any public health infectious disease outbreak, you control it by knowing who is infected, limiting isolating that patient, contacting the people that they have been in touch with, and isolating those people as well. So this is something that will need to probably happen in the UK as we try to control this virus in the future. So once we get better testing, better contact tracing, inshallah, we can control. So some other countries have been able to control this better because they had better strategies for isolation and control right in the beginning and earlier lockdown policies. Some countries, it might look like it's going okay, but actually we don't know because their health system is very weak, so we don't really know the numbers of tests they're getting. So I know, for example, in certain countries in Africa, where it can take almost 3 to 5 days to get a test result back. So how do we know what's really happening in the community? We don't know. And patients might be dying of other conditions, not COVID, and we don't know. They might be still dying of heart disease, of other infections, of malaria. So actually, we don't have an accurate global picture as yet. But for developed systems that seem to be doing better, it is primarily due to lockdown isolation measures. What we don't know is the full impact of other health conditions, such as cardiac disease, stroke disease, because once you put barriers to accessing healthcare, then these other conditions also have an increase in death. So it is not right to just focus on the death rate of COVID. We need to look at the death rate of health conditions in general. Okay, so I'm aware of the time. We're already at 8:30, so maybe another 15 minutes, inshallah. We can keep going. So question number 4. Sorry, Mizan, did you have any points to make about the R number or other countries at all?
No, I think you addressed that quite comprehensively. Thank you.
Okay, fair, inshallah. So number 4, surely people that have multiple mild or moderate pre-existing conditions that are not shielding, they should be put on the list with a combination of previous medical histories. I'm not sure I get, so let's see.
I can take that one.
Yeah, you want to try and get one? Yes.
Yeah. So what I understand from my question, I think is a good question. So there is a very specific defined high risk group who are supposed to be shielding. This is the group of people who have a very weak immune system or are on medications that has severely suppressed their immune system. And the advice is that they don't leave their house full stop for 12 weeks or perhaps even more. And there are some support mechanisms for them. And as I understand from this question, the question is asking that what if somebody has a combination of illnesses which doesn't fulfill the shielding category, but might actually in combination put them at more risk than just the high risk group. So good question. What is important to note about the shielding category, the actual list has changed a few times since it was initially introduced. And some of our patients, especially in the earlier stages, they contacted us. And for example, there was a patient of ours who was on very high dose prednisolone, which is a steroid that suppresses the immune system. Now, on some of the initial category and the initial criteria, he wasn't supposed to be shielded, but the doctors at the surgery, we all came to a uniform agreement that this patient really is in that very high risk category and should shield. And lo and behold, a few days or a week or so later, the guidance did change itself, that that person did fall into the category. So my advice would be twofold. If anybody finds themselves that they're in a situation where they've got multiple risk causing illnesses, number one is within your own scope of control, try your best to limit, as in shield as much as possible, as much as feasible. If possible, have a discussion with work whether you can just work from home and ask family members to help, ask friends to help. So do what you can within your own remit. Be as precautious as you can when you do any of the activities that might expose you to risk. And number two, have a chat with your GP surgery also. So if your circumstances is such that it doesn't fill the criteria, but it is at very high risk, they hopefully will be able to give further advice and see if there's any additional support that can be given also.
No, Jazakallah khair for that, Mizan. I think it's important probably just to remind ourselves actually that the whole coronavirus is a brand new disease. And so we are still learning about how it behaves and how it reacts to people. And so maybe sometimes the public expect us or the health system to know exactly how to manage this condition and what the risk factors are. And the reality is we don't yet have the evidence for that. You know, we're still studying the numbers. So the first bits of information only came out in February, late January, February from China. And so we were looking at data from China to guide us about what those risks of diseases are. But obviously with different populations, different countries, different illnesses, the virus might behave slightly differently. So we're now generating new information around risk factors here in the UK. So the initial list was based on what we knew, and that might change with more experience and more time. So I think the fact that this is a new disease, we're learning all the time. And those risk factors, we're also learning more about them all the time. Question number 5 was, is there any medical reason why minorities are more affected by coronavirus? Is it something to do with their genetics? So I think this is a hugely important question. And the real answer at the moment is we don't know why. When we think about diseases in general, why do people get disease? We often think about it in different categories. Some things are due to what's called social determinants. So this could be we know that even things like housing, illnesses in childhood, poverty, spirituality, even these things affect our health in a big way. We also know that the next big thing that affects our personal health is lifestyle and behaviors. We then think about access to medical care. So sometimes even getting to a hospital contributes whether you are healthy or not healthy, and genetics is part of that. So so genetics is part of all those things that can contribute to causing an illness. So the reality is we don't quite know why minority groups at this moment in time seem to be more badly affected. We don't know if it's just genetics. We don't know, is it because in general our community has poorer lifestyle, so we have more blood pressure, more heart disease. Maybe we don't use our medications as much, maybe we don't exercise as much. Maybe it's because of housing and poverty. You know, there's lots of complex reasons which we don't yet quite know. All we can say is that minorities are affected more than other groups. And so we just need to understand that and maybe take more precautions and look more at these preventative measures like we were talking about earlier on, and be more aware of severity so we get access to help earlier when we are worried about our illness. So these are two things to consider. Mizan, any additional points to that?
Also, that's a really comprehensive summary that there are several layers in which this can be looked into. And I think, if anything, what this current situation, the death rate in minority communities, which is relatively higher than the rest of the population, what it highlights is the importance of looking into it in detail, especially from a health policy point of view. So our leaders and those who direct health policy to understand it better, because it's not just coronavirus that is causing this problem. There are many other health outcomes that, if you look at smoking rates, for example, or the prevalence, the presence of certain diseases that is higher in certain ethnic minority communities also. So it's, I think it's a broader health question of why and how we are dealing with the health of certain parts of our communities, which is really important. The one additional thing I'd say is just from a health literacy point of view too. So a lot of these communities that are being affected in a more adverse way, they are more deprived, and with a deprived community, the health literacy, just understanding of healthcare concepts in general, there are obviously, everyone is an individual, but in general is less. And it just gives us the focus of, as healthcare professionals, taking a proactive approach where possible to disseminate the health information, and especially from a COVID point of view too, which makes sessions like today very, very relevant.
Lasad, I just wanted to make sure that the audience knew that Sheikh Tahir was not coming, because if they're tuning in expecting to have the reminder and they see me and Dr. Mizan, maybe they'll be quite disappointed. So do we need to say anything?
Yeah, Jazakumullah khair. After recitation, he asked if he could be excused. He's not feeling, he's fine, but he's feeling a little bit tired. He said if the doctors can carry on, and we'll carry on, inshallah. And if there is a long time between when we finish and Maghrib, again, we will broadcast the adhan on time, inshallah, live on time. And we remind that Dr. Mizan al-Haq, Jazakallah khair, he's in London. He's lucky he's going to have his iftar in 10 minutes from now, in 9 minutes actually from now. Yeah, that's the update. Jazakallah khair.
Thank you. Okay, so another really good question, number 6, which was mild or moderate asthma, rheumatology problem conditions, mild heart problems. Surely these should be considered as a whole for shielding and high risk factors. So I think this is similar to the other question that we had about multiple conditions. You know, would this put you in the high risk? And I think a similar answer would apply, that actually what we might think be high risk and low risk doesn't always seem to make sense. We cannot always logically make that conclusion. So to give you an example from an A&E perspective, earlier on, we were thinking that asthmatics might be more prone to COVID. What we now know, at least for our Leeds population, and having spoken to one of our lung consultants, he said asthma for our population doesn't seem to be linked with COVID at all. Doesn't seem to be making you get worse symptoms. But for heart problems, and we do know. So the question is then the degree of heart problems. We just don't know whether mild heart problems put you more at risk or not, because we don't have the data yet. What we have more is on the more serious kind of heart problems. Likewise for rheumatology problems, again, there's different grades of severity. So, you know, the reality is, if everyone shields, we also have to have the consequences of what does shielding do? Shielding means that you're staying at home, not having contact really with much of the outside world. As we just discussed before, when we look at health anyway in general, our mental well-being and our physical well-being is actually very, very important for maintaining our health in general. So there's a balance to be had between the risks of serious illness due to heart problems, diabetes, and then getting COVID and shielding, versus sitting at home with mild disease and not exercising, eating too much, emotionally getting depressed because you're not leaving the house. That itself will have a harmful effect on our health. So it's important to try and think about getting the balance right for these decisions. this disease is not going to go away anytime soon. It will exist in our population. Like many other infectious diseases, it will probably, either it will disappear in time with months, or it will come round into the background where it will just remain in the background after mutating a few times, like other diseases. And so we cannot remain shielded completely for the rest of our life, but we'll have to think about how do we engage with the community, but with appropriate barriers like masks, like hygiene prevention, etc., and looking after and limiting exposure to high-risk patients. So I don't think it is right that mild conditions should automatically be assumed to be high risk. That probably might cause more health problems in the longer term anyway. Mizan, any additional points to that?
No, thank you very much. I think alhamdulillah, very nicely answered.
Okay, fair inshallah. Lasad, I think there was a couple more questions you put in the PowerPoint presentation.
Yeah, they're there now in front of you.
Okay, so what about new disease linked to children? What should we look for? Okay, so yeah, so there's lots of concern now about, again, coronavirus is a new illness. We're still learning about new ways in which, unfortunately, it might affect us. And there's been something of a disease which causes multiple systems to be affected in the child's body. It's a very rare complication. The World Health Organization has now asked countries to start looking into it. And basically, this involves joints and blood vessels and other aspects. Now, it's a rare condition. In terms of what to look out for, it actually is the same as any other ill child. It goes back to those red flags that Dr. Mizan mentioned. If the child is not eating well, if the child is got high fever that is not improving, if the child looks dehydrated and tired and floppy or has a new rash that's not fading away, then that's when we should be looking out for that. So there's nothing new or specific to look out for as part of a COVID complication in children. You should be treating this like any other unwell child. If the child is unwell, you bring them to hospital, they'll be assessed. The doctors themselves will still be looking for other conditions as well as COVID-related conditions, as with any other ill child. So I don't think this should really change the way we behave around children. We just need to be alert from a medical perspective that there's other conditions now we understand. But if the child is unwell, they're unwell, they need to be seen. Mizan?
Yes, I agree. And the other thing is, just because COVID is causing a mayhem in society doesn't mean all those other illnesses that we used to be very worried about have all gone away. So those other bacteria and viruses haven't kind of packed their bags and gone on holiday too. So the general rule always has been, definitely from a clinical point of view, if mom is quite worried about a child, that child should at least be assessed. And these days, the first form of assessment is via telephone consultation. And in that telephone consultation, if I am worried, I would either speak to someone like Dr. Najib or one of the pediatricians, or get them into a appropriate place for assessment, where they can be safely assessed, and we would take further action. So, if the take-home message is this: if you're worried about your child, the GP services are there, the 111 services are there. Please do reach out and have a discussion. It might be mild, and in which case that's fine. We will make a plan together, and we will give you what's called safety netting advice, which means this is the current situation, this is what you need to do. If things get worse, especially if X, Y, and Z happens, please do get back in touch. And that list I described was just some of those advice that we give in a safety netting advice. So if the child becomes very lethargic, if they stop feeding, if they stop passing urine, so on and so forth, then those things are quite worrying. Do you get back in touch with us?
Jazakallah khair. So I think that's the list of questions, isn't it?
I think that's all the questions.
So I think that gives just enough time for us to let Dr. Mizan go and prepare for his iftar, inshallah.
Yes, thank you very much. I'll just thank you very much to the Leeds community and the masjid for hosting this event. I think it's a real pleasure to be with yourselves. It's a special time too, at the end of Ramadan, so please do remember myself, Dr. Najib, in your du'as. And as a community, I think despite all the challenges, sometimes these challenges also make us stronger and make us bond with our neighbors and other members of our community a lot more, that we help each other and we keep an eye out for each other and we kind of pray for each other too. So I think we should try to reap some of those positive experiences from the crisis that befalls us. So again, thank you very much for having me as a part of your community this evening.
Jazakumullah khair, Doctor. It's been a pleasure to have you, and may Allah accept all your good deeds.
Thank you very much.
And make dua for us also.
I will do, inshallah. Assalamu alaikum.
Assalamu alaikum. Assalamu alaikum. Jazakumullah khair, Doctor. We'll pass on now.
Dr Najib. Alaikum salam, Hanif, mashallah. Nice to have you here.
How are you, brother? Assalamu
alaikum wa rahmatullah.
I came on to answer some medical questions.
Feel free. Sometimes you could be better than us.
Let's get Brother Najib to do the fundraising and I'll do the medical questions.
He did actually both. He's done the ones for Rohingya. Yes.
MashaAllah.
Assalamu
alaikum.
So I'll leave it with you, Brother Hanif, and I'll put the video straight after. Yeah.
Okay, inshallah. So I'll say Assalamu alaikum to everyone, inshallah. Jazakallah khair.
Well, Allah accept
I hope that was something useful for people, inshallah.
Okay, wa alaikum salam, Najib. Asad, so how are we doing the fundraising today, Asad?
You're going to, you're live now as we speak. You're going to speak to the public, and I will put the video, inshallah.
You're going to put the video on first for LGM?
It's up to you.
Okay, let's go with the video, inshallah. So I'll introduce the video.
Inshallah, first I'll have to open the video. Yeah, go on.
Assalamu alaikum wa rahmatullahi wa barakatuh. Ramadan Kareem, my brothers and sisters. We hope Ramadan is going well. Subhanallah, seems only literally a few moments ago that we were opening up Ramadan and launching our appeal for this year, our very different online COVID-19 Leeds Grand Mosque appeal. But just to remind you, both in terms of Leeds Grand Mosque and what the appeal is about, we'll get Brother Lassad, inshallah, to show you the video.
The closure of Leeds Grand Mosque has presented us with a problem. Our main source of income has been removed from us. For over 2 decades building up the mosque and providing many activities for women, men and children, we do not want to see our mosque in a dire financial situation. Now, more than ever, we need your prayers and your financial support. Please give your support through signing up to a regular monthly direct debit of £20. Or, on every Blessed Friday, make an online donation to the mosque. If we come together and donate to the mosque, we can ensure we are still standing strong after the lockdown has been lifted. LGM has moved the Friday reminder online, and daily reminders will be given throughout Ramadan in these tough times. We are going to have a full Ramadan online program this year to ensure our congregation are still connected to their beloved mosque. Our Loving Box team is out there delivering essential food and medical supplies to the most vulnerable. The Living Islam Academy have restarted the children and youth Quran classes online to make sure our children are not missing out on the essential Islamic knowledge they need. The Arabic School are also delivering their classes online to the children and youth. We are also delivering the LGM Scouts online to the Cubs and the Scouts. We are still here for the LGM community and we are still ready to serve. Although the mosque may be closed, let's ensure that our hearts don't do the same. Simply text MYLGM to 70450 to donate £20 a month, or text MYLGM to 70480 to donate £20 as a one-off payment. Text costs £20 plus one standard rate message.
So alhamdulillah, my brothers and sisters, I'm sure many of you have seen the video before. I've seen it several times, and you know, it really reminds me of the one thing more than anything that I think most of us have missed this year, and that's our congregational prayer, our Salatul Tarawih, praying behind our beloved Sheikh Tahir in the Grand Mosque. And inshallah, we make dua that the opening of not only Leeds Grand Mosque, but the other mosques is not too far away. You know, I was reading recently that inshallah, in July, they're going to be looking at the possible reopening of some areas of worship. And as we say, may the masajid be amongst them. So we have very, very little time left. The days and the nights are flying by. Probably only 6 nights after this one to take advantage of this blessed month. And we've said on you know, previous occasions, but it's also worth reiterating and reminding, you know, first and foremost for myself and then for everybody else out there, that this was the month that our beloved Prophet, peace be upon him, was the most generous, and he was the most generous of all human beings. And so, you know, the odd nights, 2 may have passed, 3 may have come. And whether you donate tonight, my brothers and sisters, or you choose to wait until the 25th, the 27th, the 29th, we will make the niyyah that we will donate. We're still somewhere off our overall target. At some point, inshallah, the masjid will reopen. And when that time arrives, that's the time that we're going to be in need of these funds that you're donating now here in Ramadan. The mosque is likely to incur considerable expenditure, and we want to make sure rather that, as I say, that we're not facing difficulties. So as the video said, and as we'll remind you, you know, the masjid may be closed, but let's make sure that in these most blessed of nights, in these last 6 nights that we possibly have, that our hearts are not closed. You know, whether you give a small amount or whether you're able to give a larger amount, you know, may Allah subhanahu wa ta'ala reward you, give you jazak khair. We're just going to remind you of the several different ways of donating. The video showed you, as I said, that you can text on the 70480 to donate a one-off amount of £20. You can set up a direct debit, and as Allah subhanahu wa ta'ala has taught us, the best of charities is that which is small or regular. We still have our collection points around the Grand Mosque locality, Noshi food stores, Mahmoud Butchers, Abu Bakr. So if you want to literally go in and drop the money off there, you can do so. Or go onto the Leeds Grand Mosque website and donate via the charity checkout facility that we've set up, or finally simply give a BACS payment. So the time is running out. We're not that far away, as I say, from tonight's iftar, inshallah. May it be a blessed one for all of you. And remember us all in your du'as. And please, 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 as we say, continue to donate generously. Jazakumullah khair.
Jazakumullah khair. Again, we apologize for Sheikh Tahir. He hasn't been able to attend this evening. He said he felt a little bit tired from after the recitation. He's fine, don't worry. Inshallah, we'll see him again tomorrow at 2 p.m. and for recitation tomorrow. And the adhan is going to be in about 9 minutes. So we'll rejoin you again for the adhan. We'll have to say Assalamu alaikum wa rahmatullahi wa barakatuh now. And we'll rejoin you. I will broadcast the adhan on time later on. Jazakumullah khair. Wassalamu alaikum wa rahmatullahi wa barakatuh.